I'm Katie, I'm a second year paramedic student. Can I just confirm your name and your date of birth?
My name is Respiratory and my date of birth is the 10th of October 1988.
Okay, nice to meet you. Is it okay with you if I do a respiratory exam on you today?
Sure.
So what that includes is just me having a look at your face, your neck, your chest, your back, your hands.
Oh, cool.
Alright, so are you comfortable in this position?
Yeah.
Okay, I'm just going to wash my hands. So first I'm just going to move to the end of the bed and I'm just going to have a good look at the patient, Priscilla. I'm going to look to see if she's comfortable. I'm going to look at her colour, if she's well perfused or poorly perfused. I'm going to look at how she's breathing, if I can see equal chest rise on both sides, or chest rise. I'm going to see if she's looking short of breath. I'm going to see if she's using any of her accessory muscles to help her breathe. And I'm going to also observe the side of the bed for any medications or any other equipment like an oxygen tank that she may use to help her breathe. So Sina, can I just get you to say your name and your date of birth again?
Yep. Priscilla Molisi and my date of birth is the 10th of October 1988.
So Sila is able to speak a full sentence without having to stop for breath, and so that just indicates that she's not short of breath. I'm going to just inspect her face. So I'm just looking at her eyes. And can I just ask you to stick out your tongue, please? Looking for any central cyanosis, which will indicate hypoxia. Thank you. Can I just get you to turn to your left? I'm just going to observe her JVD. Right, normally on an angle here. And do you have any abdomen pain?
No.
So is it okay if I press here?
Yeah.
Right, I'm just going to apply pressure to the liver area, just to see if there's a rise in JVD, if you can see that. Thank you. Then I'm going to look at her trachea. I'm going to just see if it's any deviation, and it's central. And I'm also going to see the space in between both sides. And it seems equal. And also 3 fingers, so that's normal. So normally this patient would be, I would ask Sila to remove her clothing from the waist up. It just gives me a better look at her chest, and so that if I can see if there's any scars, any deformities, and see if she's barrel chested, which will indicate COPD. I'll also look for equal chest rise or good chest rise when she's breathing. Also gives me a good indication if she's using her accessory muscles to breathe. So that's what I would look for on her chest on inspection. Now I'm going to ask Sila just to hold out your hands like that. So I'm looking for any fine tremors, and I'm also looking at her nails for any signs of smoking. So for any tarring nails, doing a cap refill also, less than 2 seconds, so that's good. I'm feeling for her hands if they're warm, so well perfused. And then I'm going to ask Sila if she could just put your hands up like so, and looking for any coarse tremors, which will indicate CO2 retention. Thank you, Sila. And then I'm going to move to Sila's carotid pulse. I'm going to feel for carotid pulse. So if you could just turn to your left, and I'm just going to feel for carotid pulse. That's good. And so I'm just going to look at Sila's chest. So bearing in mind that this patient would have been, clothing would have been removed from the waist up. So look at the chest for any scars, deformities, and looking for chest rise when she's breathing. And that's good expansion. Then I'm going to place my hands on Sila's chest to also feel for chest rise. And that's good bilateral equal expansion. I'm going to also put my thumbs in just over here, and as Sila's breathing in, my thumbs should be moving apart equally, and they are, which indicates equal lung movements. And I'm also going to feel for any crepitus of the ribs. Any pain, Sila?
No.
No? that's good. Now I'm going to auscultate the chest and the lungs from the front, just to listen for any sounds that I may hear. So, bearing in mind again, the patient will have no clothes on. So I'm just listening for, so aortic and tricuspid, sorry, the aortic and pulmonary valve, as well as the side of the lungs for the lower lobes. And what I'm listening for is the clarity and the volume whenever she inhales. And I'm listening for extra sounds such as a wheeze, which will indicate asthma or any cardiac disease, rales, which will indicate pulmonary edema, strata, which will indicate upper airway obstruction. Then I'm going to auscultate again, the same areas, but this time I'm going to ask Sheila to say 99 every time I place the stethoscope on her, within the same areas. So just for example,
99, 99, 99, 99, 99, 99.
So I'm just looking for a change in vocal resonance. So an increase in vocal resonance may indicate tissue density or a hemothorax. Also going to take a rest rate. So I'm going to count Sheila's reps for a minute. So what I'm looking for is just chest rise, and I'm going to feel for radial pulse. Right, so Sheila's rest per minute is 16, which falls in normal range. And so the last thing I'm going to do is percussion. So the reason we do percussion is to see if there's a change in any change in resonance. So the areas we would percuss is the supraclavicular, the infraclavicular, the chest wall, along the chest wall, and the axilla. And what we're looking for is any change in resonance. So would dot on someone who has their clothes off from the waist up. And what we're looking for is any change. So if it's a dull sound, it can indicate hemothorax or pneumothorax, and if it's a hyperresonance sound, that can indicate a collapsed lung. So that concludes my respiratory exam. Thank you, Sheila. And I would ask the patient, if the clothes have been removed, would ask the patient to get dressed, and then I would also wash my hands. The other test we can do for a exam is the SpO2 level. Thank you.